think it's can people see it online or was it not yet? Okay, you are screen sharing.
Yeah, no, I think
They can, you can, but here it's not visible. So
they go to full screen.
yeah, it was on full screen mode. No signal input, but it's coming. Okay, great. Thank you. Thank you. All right. So, in very briefly, I think this is what I feel. These are the. So I'm so kind of trying to list what are the things that I tried to do during this pandemic, and we've heard wonderful stories earlier today. And yeah, some successes, some failures, some experiences. So of course we did develop the COVID-19 RT-PCR kit, got government approval and licensed, but also we embarked on rapid antigen test, and there we had experiences similar to Rahul. We went to some level, and then of course, Rahul was fantastic story with the ELISA that you developed, but we did have our own set of challenges during rapid antigen test development, which we got to some level. We were one of the first labs, actually. Again, I'm not saying this as a sort of a glorification of what we did, but we predicted fast mutating form of the virus even before it was clear, because we sequenced one of the early stages, COVID-19 isolates, and that got us into big trouble because there was a newspaper headline with some quote from our paper that it's mutating fast. And then I'll share that with you. And then other things which I think obviously nobody can measure, what several other things that all of us did, but assisted GOK in setting up COVID-19 testing laboratories in various parts of the country, especially in Karnataka, and Animal Commissioner in opening of industries. And we continued these efforts with surveillance that we did within SACOG, and we continue to do that. But these are some of the moments that I think come back to me, and I think it's I think in some ways the positive point is that we are better prepared. And this discussion we are having, that is really where the big value is, that we are better prepared for any new eventuality challenge that we face tomorrow. And we know what mistakes that we made this time, we won't make again, and we'll do better. I was in some ways better prepared, I think, for the pandemic situation, because my lab for last 25 years has been studying infectious diseases, large number of them, and some of them I've studied, sort of highlighted here. And at some point in my career, about 20 years down my academic career, I realized that my research is not really becoming relevant to the society. And that's when I started doing more of field work, trying to connect with the veterinary doctors, with medical doctors, with hospitals. And that really was an outcome of the 20 years of work that I had done, that I had good people who believed in me all over the country, and which helped us in addressing some issues during the pandemic and continue to help us in what we are doing. So really, this slide is really meant to give that message that what really helped us was the connect beyond science. The laboratory science is there, it's good, but I think the last mile, where I think is always a challenge, and that helped us. What also helped us was Institute has empowered us with a startup. Professor Padmanabhan encouraged us at that time many years ago, and we had a startup spun out of the lab where I'm the research advisor, and that gave us a platform. This is where I start telling you my COVID-19 story. Even before COVID-19 hit us, actually, this is something that I've never said this before very clearly, that we were doing coronavirus RT-PCR even before COVID-19 happened. And this is something that is really a culmination of 20 years of work that we had done, that we were trying to look at diseases which others had neglected. Coronavirus was one of them. We were looking at coronavirus infections, not only in humans, but also animals. And that, in some ways, it was not fair that we were already prepared. We had probably India's first RT-PCR kit already functioning since 2017 or 2018 in the lab, but we were using it for other purposes. We had to repurpose it, we had to tweak it a little bit, and then what happened is history. But I'll share with you some of the moments that how sometimes doing things, right circumstances help you to sort of try and, move towards the goal that is sometimes positive. So obviously, I'm not going to explain the RT-PCR kit itself, but to tell you that it was really our experience in coronavirus detection that came very handy. Also, many things fell in place in 2019 December, even before actually people were talking about Corona. COVID-19 name was coined really later, but much before that, we had noticed that there is an outbreak of some respiratory infection, which is coronavirus related in Wuhan. And we actually had put together a small meeting already and I'm giving you deadlines, the 31st December, when the etiology was reported, 7th January, of course, the coronavirus. In 28th January, there was a meeting going on in my laboratory where international scientists, and especially the ones from Switzerland and other parts of Europe, were present talking about global outbreaks, but also about COVID-19. By then, actually, it had become clear that this is going to be an important disease. So somehow I was at the right place at the right time. We kind of were prepared. The several years of work that we had put in already in looking at infectious diseases came handy, and we were addressing this not only within the lab, not only within the institute, but stakeholders around the country, around the world, and trying to think about how bad is it going to be? Is it really bad? And what are going to, and nobody had ever predicted, none of us sitting in that room that day predicted how bad it was going to be. But yes, I think the discussion was very helpful, and we were able to mobilize some actions at that time. At that time, we only had less than 100 cases and one death. And that then on, we really moved on because we thought that this is going to be a big one. That's really when from 15th March 2020 onwards, what we did is something that I think in some ways, I think it will remain the high point in my career. And I'm sort of, and it's full of frustrations and like everybody else. But one of the first things we did actually, and I'm going to, as I said, make it like a story, is to talk with health authorities in Switzerland and help them think about this as a major priority. At that time, the infections and convincing doctors, even in India or elsewhere in the world, was not easy. But I was able to convince Jan Fair, who's the head of the medical, travel medicine part of University of Zurich and the official hospital, that this is something that we need to be prepared with. And he got into action, setting up facilities for COVID-19 and became a national hero in Switzerland together with the work that we did together with. He was here on 28th January with us in India, in Institute of Science. And this is just showing you a moment of discussions that we had with some of the people. We were actually, it was supposed to be a global health meeting, but it turned out to be a coronavirus outbreak meeting because of the discussions that we had. Early on at that time, of course, through some of the sort of support that we received from IISc and elsewhere, we set up a meeting with Dr. Sudhakar, who was the health minister in the government of Karnataka, continues to be medical responsible for this task. And this was a time, and many of you will appreciate that we didn't yet have the COVID-19 testing laboratories. We didn't have the rules defined that NABL accreditation is required. And we were trying, because I went to the minister, health minister, and I said that I have the kit ready. Tell me how we can engage. He sat with me for 2 hours. And we decided, he wrote a letter to Balram Bhargava, then Director General of ICMR, and I show you this letter, that we have this kit ready and there are industry in Karnataka willing to support us. Let us set up testing laboratories. And this is the time when, of course, they were not yet clear as to how the testing has to happen at national level. And this, of course, they followed their own plan. ICMR followed their own plan of looking at NABL accreditation as a criteria. But this is something that we did. And we, of course, got permission for various at state level for various laboratories to start testing for COVID-19. So really, this was a high moment that I think that now finally my work actually has reached the community. I'm saying this not really to glorify my efforts, but really, I think, share with you that I think connecting with the policymakers, and this is where this center has such an important role, that connecting with policymakers is so important. If we hadn't done that, the test would have remained in the laboratory. Maybe we would have actually developed a test which would have got commercialized, but the impact we had on the society was only because we reached out to the policymakers at that time in Vidhan Sabha. Again, I'm giving you deadlines. 16th March, Industry Commissioner was in my laboratory, Madam Gunjan Krishna, and looking at what is possible, given that the situation is industry was closing down, and that's something impossible. We cannot expect industry to shut down huge losses, not only for the industry but also for the state. And we decided that let's create a strategy where we can set up testing laboratories within industries. And we work with many industries, including Bosch, aerospace industry, and to name a few, where we set up testing laboratories with the help of the animal industry commissioner within many of these laboratories as a part of government of Karnataka effort at that time. So state government COVID-19 task force was just being set at that time, and they realized that this is something we are doing. They asked me to be on the COVID-19 task force, but I said no, I will help from the background because I always knew that this is going to be a complicated scenario. I didn't want my name in the newspaper every other day and get into controversies. Government of Andhra approached us at that time, and we set up some of the testing facilities for them. And I'm showing this only because this was a time when we came out of the hidden closets of our laboratories and exposed ourselves. That look, what do you want? Where can we help you? And this was the government of Karnataka was so active, so proactive that they told some of the people, IIS officers, that this is what's happening in Bangalore. Do you need any help? And this is again a so small I think validation and gratification for how we were able to mobilize support together with Mr. Pankaj Kumar Pandey, who was the Commissioner of Health and Family Welfare at that time. And again, I show you that I visited office. It is so hard for us to get into Vidhan Sabha. But at that time, I think people were so proactive that when I approached them, at first it was, but I really had to pull strings and get into them. And these are all dates at a time you can imagine, 18th March 2020, I was already talking with policymakers about what should happen and what can happen. All of this really helped us actually to do what I shared with you in the first slide, some of the impact that we've had, which I think very few people in the institute know, but probably, and only those industries know. And again, at that time, I got a, very, very encouraging mails and letters from COVID-19 consultative group that we really appreciate the effort that you are making. This was unsolicited. When I said that, no, I cannot be on the COVID-19 task force, they said that we would like your help. We would like to be engaged. And here's a bunch of 20 IIS officers from Karnataka who got together with me in a commissioner's office at that time to devise policy about how we are going to take this forward in the rest of the cities in Karnataka. And that's another sort of something that we truly appreciate about how we work together on this. So again, my intention here is, of course, I want to relive those moments. The first testing laboratory in Karnataka, I'm showing you a glimpse of it. This was in a aerospace industry where they could not have shut down. Defense, they already had orders from defense industry, from Airbus, and they could not have shut down. So they said that tell us what is required. We want to set up a testing laboratory, and we did that. And this is the first individual being tested at that time within the laboratory. And this is myself and many of the MD and setting up the whole what you might call the protocol on 18th March 2020 for testing laboratory. And this is again, at that time Javed Akhtar was the principal secretary who appreciated the efforts and disseminated this information for other labs. Other industries. And as I said, that's how we were able to work with many other biggies who had thousands of employees who could not enter the premises of their industry. And that was unthinkable for those industries. That became possible because of efforts that GOK put in. Finally, I think I will skip this couple of slides because it will sound like I'm propagating my own sort of achievements, but that's really not the main intention, because these are all not appreciated in scientific community, because this was not really science that I was doing. As Rahul very nicely mentioned, that many of what we did, it was not that we did any big innovation, at least in terms of diagnostic tests. What we did was to mobilize the right thing at the right time and put together what was required. And that's the big lesson that I learned in my career at that time, that it's not only the innovation, but how do we get it out to a place where it is necessary. That really is the big lesson that we learned in terms of course, the RT-PCR workflow that we optimized. And in many ways, just like Rahul shared his frustrations, we also had our own ups and downs with the kits that we had to send to ICMR several times, many more kits to test again and again and again. But I think finally, of course, we not only were able to, of course, do some good academic work to show the trajectory of the virus in the host cell and what it does in the host cell at what time, but we also then finally got the RT-PCR kit approved by government of India the kit was one of the first from academia, and it could have been earlier, faster, but I think we were there at least relevant in some ways. And a couple of companies, of course, under they licensed the kit, and they white labeled and sold it in the market. So that's something that to some small level we had satisfaction. Just the way Rahul said, if things had happened at the right time, we could have had bigger successes. But I think we missed the big opportunity. Let's put it that way. Because at a time when the kits were really in high demand and were in limitation, this kit was not available because it was still undergoing validations with the regulatory bodies. But by the time the kit came out, Thermos and the big multinational companies were out there already, who had taken charge of the market. But I think this is really what it is. There is no consolation prize, as one of you, Rahul, put it, or I think Shobhan put it. There is no second prize for this innovation, really. When the product has to be out, it has to be out. No one's going to pat on your shoulder and say that, oh, what a wonderful job, we'll get you out and we'll get the product out. It's really has to be the market which decides what's available at that time and what's relevant at that time. We also developed the rapid antigen test, which we packaged, we sent to ICMR. But I think by then, some of the Korean kits had swarmed the market, and nobody could compete to create a rapid antigen test better than them at that time. We all claimed that we had better sensitivity because we all know the limitations of RAT, that 50-60% positive, and then they ask you to do RT-PCR. But just a marginal increase in specificity of 70 to 75% was not acceptable to anybody to say that now this kit has to be developed further. I could go on and share these experiences, but I would say the two highs, I think, and I'm showing you a blank slide here, but two highs during this point was that, and I think that personally this was the most satisfying moment, was I was responsible for bringing down the cost of the RT-PCR testing kit, because I went to the newspapers and said the testing kit cannot cost 4,500 rupees. It should be under 500 rupees or at least under 1,000 rupees. And everyone was so disappointed with me. All the industry people started calling me. This was a time when one test was for 4,500 rupees. And knowing what I knew, I said that this is impossible for an average person from India to be able to pay 4,500 rupees. Of course, people did that early on, and lots of people, of course, we know what happened. But this is when things changed. It came down from 4,500 rupees to 1,200. I became quite unpopular in the industry, but I think in the end that had to happen, despite regardless of who took the initiative. Second high was, of course, when the Parliament notice in the newspaper article, and thanks to Indian Institute of Science authorities who publicized my paper, and there was a sentence, one paragraph, which said that it's a fast mutating virus. And some politician, some member of parliament on a flight in the newspaper noticed it, and he sent a note to the director of IISc that we saw this from someone from IISc. Can you please explain? Because it's creating panic in the country when you say it's a fast mutating virus. And I got a note from the director, summoned me that, look, explain this, because we have to send a note to the parliament. That was probably the scariest moment for me, because this could get you into big controversy, and we are never prepared. I think somebody else Anand mentioned about the police phone call that he got. It was somewhat similar, except that, and we are never prepared for this kind of things, right? Because we have never ventured out in the real world trying to make statements and do beyond our own laboratory. But I think we got our act together, and the brave heart students, of course, said that we stick to this, because the data that we have, although limited, it clearly shows that it's fast mutating. And the point was actually discussed in the parliament in subsequent sessions. And luckily, it did not become a controversy, because we showed all the supporting documents. It was something like INSACOG was already sequencing at that time, but it was early days of INSACOG. And they didn't have data to connect with us and say that, look, together we will convince this. Later, INSACOG had the same problem, that they said that the authorities did not listen to them, and that's why we had horrible second wave. I would like to conclude at this point and say that what next? So yes, we did what we did, a bit of trials and tribulations, frustrations, moments of high, moments of success. But important thing for all of us, I think, and who presented their parts of the story, is that we have to continue, because what we did actually may not have succeeded to the extent that we wanted. But if we continue these efforts, I think someday we will get it. The experiences, the learning that we had, that jugaad doesn't work. It's in the end the market that tests you, and regulatory bodies are in the end the deciding authorities. Really, we have to take these experiences with us and then move ahead. And I'm sure Center of Policy, Science Policy, which I think we and others are taking forward, will support us next time around. Hopefully there's no pandemic, but any such situation where science has to be deployed, we will be better prepared. We are currently doing this with INSACOG. We continue to do sewage surveillance, and we currently continue to do it. It's like, we think it's like beating a dead horse, but no, there is always a chance that there may be a few more cases and we try to predict these cases together with other partners. There are several partners in Karnataka now who are doing this. There's a program which is going on for sewage sample testing, including the one in IISc, sewage treatment plant, which we continue. And we have reoriented it that maybe COVID-19 will not surge again, and maybe it will, but we are now looking at a bunch of other diseases, like Rahul said, it's probably not end of the story. We have to be better prepared and use these experiences, and which is what we are doing. We are looking at a bunch of other infectious diseases in sewage, and also in many field studies that we are taking on from here. I would like to conclude and thank, I think, how helpful, it's always easy for us to criticize the government authorities, the regulatory bodies, the institutions, the scientists, everybody. Anytime you try to do something, we will be met with criticism. So I think I look at everything in a very, very positive way, that look, we did get the support that we did get. And that's why we did whatever little we did, because no one knew what is the right thing to do. So we really can't blame anyone. And then let's move on from there and see what are the positive lessons that we have. How can we build on it? So I'm immensely thankful to ICMR, Department of Biotechnology, CSIR, which had mobilized many initiatives at that time. COVID-19 Task Force of Karnataka, I think they couldn't have done better. BBMP, I told you already, we always have such wrong impression about IIS officers, that they are bureaucrats and they just are complicated. But my experience completely changed this opinion I had, that they are smart, actually. They're probably the smartest people in the country. And I think we have to respect. It's just that we have to learn how to work with them. And this is something that I learned, and many other industries who believed. I think the good thing is that being at IISc is great because everybody believes in IISc. That's really is such an amazing, what a wonderful, we are so blessed to be in IISc, that when we have the name IISc with us, people, it gives us so much credibility in terms of what is possible. They think that you can do, they think that you can help. And then we are able to help to some extent, and hopefully better next time. With that, I want to thank again all of you who made this happen, even though the offline audience is small, but I'm sure the message has reached. And I'm so happy to hear also the stories from Rahul, Sushoban, Anand, and I think, and I'm sure the discussion that we will have following this. Thank you so very much again. I appreciate giving this opportunity.
We leave the laptop for a few minutes and then